podcast. Today, joining me is Dustin Elliott, a chiropractic physician at Pioneer Sports and Pain Center. Welcome, Dustin.
Thank you. Thanks for having me.
Yeah.
Appreciate it.
Yeah. So let's go ahead and tell our viewers a little bit about yourself and what got you into the business, about your family, all of that.
Yeah. So I have been a practicing physician since 2016. I'm an Idaho native, so shout out to the Idahoans. And our clinic is actually just south of Meridian Road, about 7 miles of the freeway. We initially were founded in 2011, and it just started out as one practitioner, Kyle Burnshaw, the owner of the clinic, and it grew to now 2 chiropractors and a full-time physical therapist. So
awesome. Yeah. So when a patient has some pain, so when can they tell if they should go see a chiropractor versus maybe going to the ER or urgent care? So maybe you can tell our viewers about that.
Yeah. So I think it's important for everyone to understand what we specialize in, and hopefully that can provide some insight on the other options. We specialize in musculoskeletal care, muscles, obviously, joints, not only in the spine, but in the upper and lower extremities. And in those particular events where, you get injured and it's difficult to weight bear, or maybe even to move your back or neck, we've had cases where they come into our office where we're referring out to an urgent care, or we see in our office where it wasn't as concerning, and they could have started out with us. So I always invite people to consider us as a first option approach, because when they come into us, of course, if you can't weight bear or move your back or neck, then you consider going to an urgent care for pain management. But we integrate ourselves really well with the medical professionals, where we aren't afraid to send them out to get a prescription med to help manage the pain, so that they can follow up with us and vice versa. So I think that anybody that's questioning can always call our office. We do free consultations where they can walk in, they can meet with us briefly, and we can provide our insight to let them know. But a lot of the times it can save them some time and money, because of patients' interest in wanting to go the more conservative route than get prescription medication. But sometimes it's necessary.
Yeah. So going off of that, what kind of services do you guys offer in your clinic? Maybe you can give everyone a little insight on that.
Yeah. We, I might kind of preface that with chiropractors, all the ones that I know of take a national board exam and for physiotherapy, which allows us to prescribe and treat not only the spine and the joints in the body, but to treat the soft tissue work as well. So we're able to prescribe therapeutic exercises, muscle stimulation and heat, ultrasound, and electrical stimulation. But a couple of the unique services that both our physical therapists and chiropractors provide is dry needling. Okay. It's similar to acupuncture, where we're using the same needles, but we specifically target areas of pain: headaches, plantar fasciitis, rotator cuff tendinopathies, tennis elbow, golfer's elbow. We found a lot of success with that. Another service that we provide it's called fascial scraping. And this is, the technical term is instrument-assisted soft tissue technique. It's Graston, where we're treating kind of the similar areas of, the tennis elbows, the golfer's elbows, shoulder tendinopathies, and basically to not only address the restriction at the joint, but also in the soft tissue as well. And working both ends of the spectrum there, I feel like has provided great results for our patients. So, another one is cupping. It's similar to our soft tissue work technique that I just mentioned, but it allows the 3 layers of the skin, the fascia, the skin, the fascia, and the muscle to increase blood flow and immobilize those areas that are tense and tight. And we found that some patients really prefer that or respond better to that than our fascial scraping. And then lastly, spinal decompression. It's been a new service that we've added to our clinic, allowing us to bridge the gap between patients that aren't really responding well to conservative care, especially in the neck and the lower back. Disc issues, symptoms down the arms and the legs can be really annoying and difficult to deal with.
Yeah.
Obviously, you have the pain that comes with it, but anybody that's experienced nerve discomfort, it's pretty, it can be overwhelming. And so if they're not responding to our conservative approach to physical therapy or chiropractic, we often will get them onto our spinal decompression table, where we can relieve the pressure of the disc that's likely pushing into the nerve roots that's causing the radiculopathy. And so far, our patients have responded really well to that.
Great.
So, yeah.
Awesome. Yeah. Well, so maybe we can tell our viewers, like, if they were to walk into your clinic, what would kind of be that first patient experience for them? Yeah.
So we offer our paperwork to be done online, so they can come in and they don't need to spend all the time in the office filling it out. So that's convenient. But they can expect a thorough examination. Our initial treatments typically last around 45 minutes, and our following visits last around 30 to 45 minutes, depending on what they're dealing with. But it's one where we go through a review of systems, so we're making sure that we understand their health history and previous injuries. A lot of patients come in with obviously a specific area of pain, but a lot of the times knowing the full health history can provide us a better understanding of maybe the area that they're coming in with pain is secondary to another issue. And so we really do take the time to sit down with our patients and help them understand what their injury is.
Awesome.
So,
well, Dustin, if someone were wanting to get a hold of you to schedule an appointment or anything like that, how would they best go about doing that?
They can, of course, view our website, and I encourage any viewers that are interested to learn more about our clinic to go there. It goes into detail about the specific services that we provide, but it also will explain and get patients more comfortable with our clinic. We have a tour of our clinic, and they can go there even and request an appointment. Our telephone number is there on our website, 922-4908. And like I mentioned before, we do free consultations, walk-ins. And so if anybody has any questions, we're open to help.
Perfect. Well, Dustin, thank you for joining us this morning. I have a great deep appreciation for what you do. And we just really enjoy having you on our program.
Well, thank you. Appreciate it.
Make sure to tune in next week for our next Business Buzz program with Axia Home Loans. Until then, have a great week.